Part 2, Foundations, Attention Deficit Hyperactivity Disorder, acronym ADHD, by Dr. Marty Harris. This presentation includes audio that reads the slides. Therefore, closed captioning will not be used. Prevalence and identification and assessment. Prevalence. 3 to 7% of school-age children have ADHD. However, it is very difficult to determine the exact percentage because so many students go undiagnosed, and ADHD exists concomitantly with another disability. When ADHD is identified as the primary disability, it can be served under OHI or through a 504 plan, and therefore not be counted in the ADHD census. As many as 50% go undiagnosed, more males than females in all subtypes. Some studies report 3-to-1 ratio, others 6-to-1 ratio for boys versus girls. Of girls with ADHD, 29% had ADD subtype compared to 2.3% of boys. College students, 2 to 4% have ADHD, but many go undiagnosed. Many college students have ADD and go undiagnosed. Source: Kirk, Gallagher, and Coleman, 2015. Prevalence and ethnicity. Majority of students with ADHD are Caucasian. White, non-Hispanic children comprise the largest group of children with ADHD, 4.1 million, representing 8.7% of all white students. Black children are more likely to be identified as ADHD than white children. Only 5% of Hispanic or Latino children are identified with ADHD. Source: Kirk, Gallagher, and Coleman, 2015. Prevalence and other disabilities. Frequently, ADHD is associated with other conditions, including one or more of the following: learning disability, acronym LD, oppositional defiant disorder, acronym ODD, obsessive compulsive disorder, acronym OCD, conduct disorder, depressive disorder, anxiety disorder, and Tourette's syndrome, acronym TS. 50% of the students with ADHD also have speech and language impairments, acronym SLI, particularly language disorders, and are identified at a young age for SLI. As their language improves, they may be dismissed from special education services without identifying ADHD or continuing services for ADHD. Prevalence of hyperactive impulsive subtype. 75% of 4 to 6-year-olds with ADHD have hyperactive impulsive type. 85% of the students with ADHD have the combined type. 70% continue ADHD into their adolescence. 50% continue ADHD into their adulthood. Prevalence of inattentive subtype, acronym ADD. Majority are girls. Students with ADD often go undiagnosed. ADHD and other disabilities. As indicated earlier, many students who have ADHD also have another disability. The next several slides present prevalence facts. LD and ADHD overlap. We have two overlapping circles, on the left LD, on the right ADHD. Approximately 10 to 25% of the children with LD will also have ADHD. Some estimates are as high as 70%. Source: Hallahan, Kaufman, and Pullen, 2009. ADHD and IDD overlap. On the left, we have the ADHD circle, and on the right, the IDD circle. Approximately 20% of the children with IDD also have ADHD. Source: Heward, 2009. EBD and ADHD overlap. EBD, emotional and behavioral disorders, on the left circle, ADHD on the right circle. Approximately 25 to 50% of the children with EBD will also have ADHD. Source: Hallahan, Kaufman, and Pullen, 2009. Tourette's syndrome, TS, and ADHD overlap. TS on the left circle, ADHD on the right circle. Approximately 50% of the children with Tourette's syndrome will also have ADHD. ADHD and Tourette's syndrome and OCD overlap. Left circle, TS. Middle circle, ADHD. Right circle, OCD. Approximately 1/2 of the children with Tourette's syndrome will also have OCD. Many of these children will also have ADHD. Identification and assessment of students with ADHD. 5 evaluation components. 1. Medical examination. 2. Developmental history. 3. Clinical interview of parent and child. 4. Teacher and parent rating scales. 5. Behavioral observations. Assessment instruments. Connors Rating Scale, ADHD Rating Scale, Devereaux Behavior Rating Scale, Continuous Performance Test, acronym CPT, Functional Behavioral Assessment, acronym FBA. Teachers' roles. It is important to note that teachers or school districts do not diagnose ADHD. Our role is to point out possible evidence to parents. If the parent is concerned, then they should take the child or adolescent to a physician. However, some districts now have strict rules that educators cannot even suggest that a student may have ADHD. Why? Because the district considers it a health problem, and they do not want to be wrong, and they do not want to be required to pay for health or psychological examinations. Follow your district's rules. Teachers' roles. Continued. After a student has been diagnosed with ADHD by a physician, psychologist, or psychiatrist, then teachers may be asked to do more in-depth observations or fill out behavior rating scales. Teachers and parents will be asked to complete rating scales so the data represents more than one rater and more than one setting. After a diagnosis is completed, a functional behavioral analysis, acronym FBA, should be completed to inform intervention plans. One thing for sure, children and adolescents with ADHD will be in your classrooms. Research shows that teachers actually know very little about ADHD and how to help these students. In the next 25 years, more research will direct parents and teachers towards successful interventions for students with ADHD. So make it your commitment to be a lifetime learner about ADHD, because their education should be special. References: Friend, 2011, Hallahan, Kaufman, and Pullen, 2009, Eward, 2009, Eward, Alber-Morgan, and Conrad, 2017, Kirk, Gallagher, and Coleman, 2015, Smith and Tyler, 2010, Taylor, Smiley, and Richards, 2009, Turnbull, Sjogren, and Weimeyer, 2016, Vaughn, Boss, and Shum, 2016. This presentation is copyrighted by Dr. Martha Jane Harris, 2017, 2015, 2010, 2005, 2000, and 1998. Thanks for listening.